For over half a century, Canada has been a world leader in the production, use, and development of life-saving medical isotopes. The world is counting on Canada to expand this leadership role to support the diagnosis and treatment of cancer, ensuring medical equipment is safe for use, and to tackle some of our greatest challenges in health sciences. Welcome to the Canadian Nuclear Isotope Council's Isotopes for Hope podcast with your host, James Scongack, Chair of the CNIC. In this series, we interview Canadian leaders who are making a difference every day. We hope you enjoy this episode of the Isotopes for Hope podcast.
So welcome today to the Canadian Nuclear Isotope Council podcast, Isotopes for Hope. I'm really excited to have two very special guests with me today, and we're going to really talk a lot about brain tumors in particular, but a tremendous amount of work going on throughout Canada to not only support patients and families that are impacted by brain tumors and cancer broadly, but a tremendous amount of innovation. And I'm pleased to have with me today Dr. Arjun Sahgal. He is an international clinical research leader in the field of high precision stereotactic radiation to the brain. And we know what stereotactic radiation is because we recently had a podcast with our friends at Nordion. So we really look forward to digging into that. In addition to his current responsibilities as an international clinician, he also serves as the chief of the Department of Radiation Oncology at the University of Toronto affiliated Sunnybrook Odette Cancer Centre. He is also the director of the Sunnybrook Cancer Ablation Therapy Program, which is involved in the installation of an MR brachytherapy suite and a series of other technological advancements, including the gamma knife, and I know we'll be talking about that today. I could go on for a long time about Dr. Sahgal's biography, but he's a world leader, a leader here in Ontario and Canada, but also somebody that, in addition to all of these leadership responsibilities, I know always puts patients first. So really appreciate you joining us today. I also want to welcome Shannon LaHay. Had the opportunity to work with Shannon previously during some of the work we did with the Brain Tumour Foundation of Canada. As people know, the Brain Tumour Foundation is a national nonprofit who's really focused on supporting both patients, families, and survivors of people impacted by brain tumors. And they carry out a range of work to not only raise funds, but raise awareness and support families. So thank you, Shannon and Dr. Sahgal, for joining us today. Thank you.
Thank you.
So why don't we start with you, Shannon? And you know, some of the statistics always surprise me. Oftentimes we think of a brain tumor as something very rare. And the statistics, both here in Canada, but around the world, are anything but rare. Can you sort of just set the table for us and talk firstly about what is it that the Brain Tumour Foundation of Canada, what's your mission? What are you focused on? But most importantly, how many patients and families across Canada are impacted by brain tumors?
Yeah, I think you started out with a really great point about us thinking of them as rare, and they're really not. We know that 27 Canadians every day will hear the words, "You have a brain tumor." Many of those are malignant, many are non-malignant, and as a foundation, we do support across Canada more than 55,000 people right now on a brain tumor journey. So the rarity, I think, comes from really the number of different brain tumor types that are out there. There are 120 different types. So for each patient diagnosed with one of those types, as a collective, it is not a small group of people.
And when we think about brain tumors, the 27 a day from a Canadian perspective, is it safe also to say, Shannon, that when you look at similar organizations to the Brain Tumour Foundation internationally, that would be statistically the same number of people impacted by brain tumors elsewhere in the world? I mean, they may not have access to the same sort of healthcare that we do here, but would that be a sort of a global trend that would be fair to extrapolate?
Yeah, I would absolutely say so. I would say that in the past we used American data to understand the prevalence or the different types of brain tumors that were out there and the number of people being diagnosed. Several years ago, Brain Tumor Foundation of Canada actually helped facilitate the creation of the Canadian Brain Tumor Registry. And what we found there was what's happening here in Canada is very similar to what's happening in other places across the world where that data is able to be collected.
So now shifting to Dr. Sahgal. So, we can talk about this in a sort of from a macro perspective, as Shannon did a great job articulating. But at the end of the day, doctor, it's you're dealing with patients right at the end of very difficult circumstances. So while our numbers here in Canada statistically may be very common with the rest of the world, I think what is unique about Canada is the leadership role that clinicians and leaders like yourself in the system play to help patients who have a brain tumor that could be very serious. Can you talk about, in your practice, what is unique about what you at Sunnybrook and other Canadian institutions offer in terms of hope and treatments for patients?
Right. So the most common type of malignant tumor that's life-threatening is the glioblastoma. And what we've seen over the years is not only a small increase over time in the general population getting glioblastoma, which is an incurable cancer, where most people live about 1.5 years, and some more and some less, but also an increase in younger patients that are actually having these lethal forms of brain cancers. And that's what's led us, in particular in Ontario and several centers across Canada, to really start to probe the molecular genetics and understand who's going to do better and who's going to do worse, and try and tailor or personalize our treatments more. And so one of the advances we made at Sunnybrook was we brought a special machine called the MR-Linac. And what it was for the first time an MRI and a linear accelerator that delivers therapeutic radiation combined for the first time. And so now we started to do what we called adaptive radiation. So every week we actually replan to the patient's brain tumor and create a new radiation map. And we're hoping that this is going to reduce toxicity, because we know now that there are some patients that are going to live for many years and then suffer the side effects of the radiation. So this is an evolving clinical trial that we've performed the first in the world of adaptive radiation for glioma, and now we're continuing on with several others. So that's just one special aspect of what Sunnybrook is offering. And then in the other area of more common brain tumors, when we categorize them, are brain metastases. So this is when you have a cancer, say, of the lung or the colon, and then it spreads or seeds to the brain. And in that situation, we want to avoid whole head radiation. And we've been very strong advocates to avoid whole brain radiation as a therapy of last resort, because it's a very palliative situation. And we're learning that more patients are living far greater than ever before with novel targeted therapies and cancer drugs that actually target the cancer much more smartly. But we have to control the brain. And that's where technologies that allow for stereotactic radiosurgery are important. And one such one that we have in Sunnybrook is called the GammaNet, and it's a cobalt-based unit. And why that's important is that there are certain properties of cobalt, when they're arranged in this way, that allow the radiation to be delivered in a very precise and the least damaging to the collateral normal brain tissue than any other technology, especially now that we're starting to treat 20, 30, 40 brain metastases. Can you imagine? There's some patients that have 50 brain metastases, and now we can target them all, and we do so on a clinical trial. And again, we're one of the first in the world to do this, and we developed a special technique called a spare technique. And spare means trying to spare as much healthy brain tissue as possible. So we're using the technologies to try and do better for patients, not only to treat the cancer, but to avoid the collateral damage.
Well, and I think what's really important about that when we think of the isotope ecosystem here in Canada is that cobalt-60 that you referred to, and we recently had an interview with our friends at Nordion, and we talked about how at the Bruce Power facility, which where I come from with my other hat on, being the world's largest producer of the high specific activity cobalt-60 that is used in that. And so, it seems to me that as we talk to clinicians, and would be interested in your perspective on this in terms of to use a hockey analogy, where the puck is going. It seems to me that there's a trend really being led here in Canada, but is impacting the rest of the world on more personalized treatment. Can you talk more about that? Like, if we were sitting here 10 years from now and we thought about radiopharmaceuticals globally, how should we be thinking about the patient treatments of the future?
Right. So I think it's going to change dramatically. So in parts why it's so important on the radiopharmaceuticals is that we're going to diagnose the tumors better by using novel PET agents. And there are some that we develop actually in-house on our cyclotron at Sunnybrook, and then deliver it to the patient because we can't get access otherwise. And we have to do it on a trial. Even though it's relatively standard therapy in many centers in Europe, we're still lagging behind here. And I think that was some of the issues that were brought up in the Auditor General's report to improve our ability and access to specialized PET diagnostics. And it's very important in the brain tumor world. There are some tumors that we're realizing, for example, very aggressive meningiomas. And we think of meningioma sometimes as a benign tumor that you're not going to die of and you can cut it out or treat it focally. But when you have this increase of more malignant types of meningiomas, so these are aggressive meningiomas, that can take a patient's life. We're finding it very hard to control this. But if we knew where the areas of activity were to precisely then zap it and zap those areas better, and there are novel PET agents that can do this, then we would be able to further our abilities. So what we've been doing as we've been trying to investigate, in particular, these novel PET tracers in glioblastoma, but we're trying to create a program for meningioma, which many places, again, in the world that have better access to these agents are doing right now. And so one of the areas in these malignant meningiomas is to then use a technology, like a standard technology of delivering radiation for, say, the 6 weeks that we normally do, but then use the gamma knife to boost those particular areas. And if we can do a smarter boost based on knowing where the activity is of the aggressive cancer, as opposed to treating the entire tumor, then we could do better. And I think that's how we're going to see it in the future. And then as though the drugs that are getting smarter towards the actual cellular architecture and the receptors there that are on a cancer cell, once we label the PET agent with those drugs, and then it can go and smartly attack and drop the bomb in the cell and blow it up, that's where we're going to get even better. So I think in the future, what we're going to see is a much more precise way of diagnosing, understanding, and treating these tumors to reduce, again, collateral damage and increase cure.
Yeah, no, and I think that's spot on. And what I liked about in your comments is how you really, talked about the importance of cyclotron technology for certain applications, and let me call it reactor-based isotopes for other applications. And one of the things that we've really emphasized is that Canada is a leader in both of these spaces. Both at the front end of the production, but also the use and the deployment. So Shannon, just want to flip to you because Dr. Sahgal talked a lot about, I like the term heat-seeking missile and ensuring that, at the end of the day, this is also not only about treating the brain tumor or treating the cancer, but also making sure what quality of life does the patient have after that. And I know one of the areas the Brain Tumor Foundation focuses a lot on is survivors. So can you just talk to us about, we've had other guests and we're always reminded that cancer is not something that impacts somebody for a distinct period of time. Regardless of the clinical outcome, it's something that impacts a patient and their family and their loved ones for years. Can you talk about some of the challenges that survivors face and some of the tools that your foundation puts in place to help survivors and their families? Because, really what Dr. Sahgal is talking about is preventing some of these challenges that patients and survivors are faced with.
Yeah, absolutely. And I really appreciate the point about non-malignant tumors being considered benign and how that's just not the case when we're talking about somebody's core processing center. There's nothing benign about that. So even when we are supporting patients and families dealing with a non-malignant tumor, the impact on their life, the quality of life, that's where we need to support them. So as an organization, we offer a lot of support systems to sort of reduce that impact support groups, individual support opportunities. A big piece of that is the advocacy piece and giving a voice to the community to have a say in what their life looks like and what their treatment looks like. So our advocacy efforts are really important to us as an organization to be able to share that perspective so that it's considered when we're talking about government agencies or the healthcare industry, that they are considering the patient perspective, the survivor perspective, and the impact that treatment, access to treatment has on that whole family unit.
And one of the major areas that we've had a lot of conversations about is Canada's unique leadership role, not only in the space of medical isotopes, but broadly, fighting cancer globally. And we often say that we're a relatively small country, under 40 million people, but this is an area that there's not only a moral imperative for us to provide leadership in, but it's also an area we punch above our weight. It's about patients first, but it provides a tremendous amount of innovative development, whether they be economic, whether they be research opportunities here for Canada. And so Dr. Sahgal, I know you have worked internationally. Your practice at Sunnybrook in particular is respected internationally. How should Canadians think about the work that we are doing in institutions like yours from a global perspective? How do we stack up? Where is it that Canada can play a global role? Because we have countries around the world, huge populations in countries in Asia, of people moving into what they would define as the middle class for their populations, wanting to have access to a lot of the treatments that we have, I must say, take for granted in Canada. That would, certainly patients impacted don't take that for granted, but we've come accustomed to. So can you maybe put that in international context for us?
Yeah, I travel again many different countries, and I teach in very different countries. We perform research and collaborations, and I see how patients are being treated. And I'm always proud of the fact of how we treat patients in Canada, in particular. Right. In Ontario, as where I am, because we don't have the same barriers. So for example, in the United States, let's say, unless you have insurance, you can only get this technology or you can get this drug. And we don't have that. We have a centralized system where patients are treated fairly. And if I need to use this technology and a gamma knife for that patient and an MR knife for the other, I can do it. I do the best thing for that patient. And so that's where we should really feel proud, and in particular, the investments that the government has provided for us to offer these technologies. And we always need to do better. So this is where the advocacy piece comes in, and working with our partners like Brain Tumor Foundation of Canada to say, well, look, we're doing really great here, but we need more, say, specialized PET resources, or we need some specialized radiolabeled theranostic treatments to then advance even further. And when we do get that, then we apply it more broadly to the entire population. So I think that's something that we should feel proud about, as opposed to only select patients who can afford it. So that's one aspect of it. And I think part of our mission and our responsibility is to then train the rest of the world, and especially emerging markets. Right. Because we have to go out there and show them why you want to make this investment and how you can make patients better. Because it is costly treatment, it does benefit patients, and the economic reality of patients surviving longer is a healthier economy. And that's what we have to ensure, that you are doing bigger and better on a global scale by patients living longer and offering the best treatment.
It's a perfect example of when we're doing the right thing is also the right thing economically to do. You're talking about treatments that lead to better outcomes, which allow those individuals and their families to go on with more regular lives. We won't pretend they're not significantly impacted by it. That's an interesting perspective.
I'll give you an example, of a patient, let's say, that we treated. And this patient had been treated previously in the past in the United States and lived with a very rare form of brain tumor. And lived for about 15 years until it came back, right? And very successful in their job, contributing to the economy, and then went all over the world to say, how can I get this treated? And many leading institutions in the United States even, and everyone said, no, it's too dangerous, right? So they got sent to me at Sunnybrook, and we had this technology with the gamma knife. And I said, well, look, there's very specific attributes to cobalt-60 that no other technology can do, especially in the way that it's delivered. So we treated her, and she was young, and we gave her a full 6 weeks more of radiation using the machine in a way that no one else had ever used it before. Targeted, cobalt-based, very precise, and she's alive now 4 years later. She's still working, she's contributing, she's having a relatively normal life, and she's here when everybody had said no. And we were only able to do this because of that technology and having that ability to do it for her, where we published it. It was the first patient in the world ever to be treated this way. And I go to other countries, I say, well, why don't you do it this way? Oh, the insurance company would never let us do it. Oh, the hospital would never do it, even though it's better and we publish. So we do our bit to try and advocate and publish our results and push the limit. And then we push harder over time for global adoption. And we will get there, but it takes time.
Well, and it's really about ensuring the clinicians have the right tools in the toolbox, depending on the patient needs. That's a compelling story and a great story, and it reminds us what this is really all about in the end. Shannon, just to maybe just go back to you. So a key focus of CNIC and our Isotopes for Hope campaign is, and you talked about this as well, is around advocacy. What is it we need to see more from our either federal or provincial governments? If you could have an ask of governments at the federal or provincial level in terms of the brain tumor community, what would be at the top of your list?
Interesting, because Dr. Sahgal talked about some of the places where we don't face barriers in Canada, and it's wonderful, but the truth is we still face many other barriers. And so I think the single biggest thing that the government can do is simply work with us to reduce some of those barriers for healthcare providers, for researchers, for patients, for industry, to be able to provide more access to the amazing treatments that is life-saving, increases quality of life, all of those pieces. We have patients across the country who simply by geography or lack of means or ability to travel don't have access to some of that care. So increased funding and infrastructure for research, for diagnostic tools and treatment. These are the things we want to keep advocating for, and it's going to keep going. We're going to see improvements. I think the government has certainly shown that they want to see our patient population thrive, contribute to the economy, but we're always going to have to keep working on that.
Absolutely. Well, listen, I want to thank you both for joining us today, but most importantly, I want to thank you both for what you do every single day. There's Canadians and patients that rely on your leadership, whether it's through a not-for-profit, whether it's Dr. Sahgal, your work leading a very prominent healthcare institution in our healthcare system. But most importantly, what's very important for the CNIC and as part of this Isotopes for Hope campaign is that what we do in Canada can impact the rest of the world. Listening to what you've been able to share with us inspires me. It also reminds us that we need to continue to move as quickly as possible because we have the tools, we have the technology, we have the capability here in Canada. And the quicker that we can move on these items that we're talking about, it's patients at the end of the day will benefit. So thank you very much for your leadership and for joining us today.
Thank you.
Thank you for listening to this episode of the Canadian Nuclear Isotope Council Isotopes for Hope podcast with James Scongack. Please share this podcast and follow us to stay in the loop. To learn more, please visit our website at canadianisotopes.ca.